Stomach cancer occurs when there is an abnormal growth of cells in the stomach. 1. The abnormal growth originates from a few cells and can gradually progress to form a cancerous lesion in the form of a bud or an ulcer. This process can take at least a few months or a few years. Therefore, in the early stages of tumor formation, if not screened early, the disease will not be detected. The disease can affect any part of the stomach, but most commonly the main part of the stomach, the body of the stomach, and the junction of the stomach and esophagus. The esophagus is the tube that carries food from the mouth to the stomach. Stomach cancer is the third leading cause of cancer deaths in both men and women worldwide. It has a high mortality rate but is difficult to diagnose because it often does not show symptoms in the early stages. Based on the level of damage, stomach cancer is divided into 5 stages, including Stage 0. Cancer cells are just beginning to appear in the lining of the stomach. This is also called epithelial cancer, and is an early stage of stomach cancer. Stage 1. Cancer cells have damaged the second layer of the stomach. Stage 2. Cancer cells have invaded through the lining of the stomach. This stage is also called submuscular cancer. Stage 3. Cancer cells have grown into lymph nodes and other organs in the body. Stage 4. At this final stage, cancer cells have metastasized throughout the body, causing a high risk of death. The stomach is a J-shaped organ located in the upper abdomen, part of the digestive system. When a malignant lesion forms in the stomach, depending on the stage of the disease and the location of the lesion, the patient may have different signs. However, in general, these signs are often quite vague and not specific to stomach cancer, because these signs can also appear in other benign diseases of the stomach. Signs of stomach cancer may include early stages, usually divided into 2 main groups. Gastrointestinal disorders, difficulty swallowing, belching, acid reflux, heartburn, feeling of nausea, vomiting. Pain sensation, dull, non-cyclical pain, pain when hungry, pain in the area below the sternum after eating. Progression stage, also divided into groups as follows. Digestive disorders, nausea and vomiting, frequent heartburn, constant bloating, feeling full after eating little, loss of appetite. Pain sensation, often severe pain after eating, or dull, non-cyclical pain, pain when hungry, pain in the area below the sternum after eating. Bleeding in cancerous lesions of the stomach, anemia, bloody or black stools, yellow skin. Malabsorption, malnutrition, sudden, unexplained weight loss, dizziness, fatigue to the point of reduced ability to work. Causes of stomach cancer. Infection with the bacteria H. pylori, a common stomach infection that can sometimes lead to ulcers. 3. Gastric polyps, abnormal growths of tissue that form on the lining of the stomach. Recurrent gastric ulcers, or history of surgery for benign gastric diseases. People 50 years of age and older. Men are at higher risk of stomach cancer than women. Smoking, drinking alcohol. A diet high in foods containing preservatives. High in grilled or smoked, pickled foods. Low in fruits and vegetables such as fermented foods, canned foods, and smoked meats. Obesity. Family history of stomach cancer and/or other gastrointestinal disorders. Asian, especially Korean or Japanese, South American, or Belarusian, may be related to eating habits. Diagnostic measures for stomach cancer. Early-stage stomach cancer is often difficult to detect because the symptoms are similar to gastritis. Therefore, to detect stomach cancer early, patients need to go to the hospital to be examined by a doctor and have diagnostic measures applied. Diagnostic measures for stomach cancer commonly applied at hospitals include gastroscopy. The doctor will use a long, Flexible tube with a camera attached. Passed down the esophagus and into the stomach. If any suspicious lesions and/or tumors are detected, the doctor will order a biopsy. Gastric biopsy. This is a technique of taking tissue from different locations of the stomach, then processing and cutting it thinly for microscopic examination, to determine the normal, abnormal nature of benign or malignant abnormalities of stomach cells, also known as pathology. Blood test. In some cases, doctors may order a blood count test to assess the patient's level of anemia. In addition, doctors may also order other blood tests for liver and kidney function, tumor markers, etc. to supplement pre-treatment assessment information and/or coordinate post-treatment monitoring. Check the image. Your doctor may need additional imaging tests to diagnose stomach cancer through the following imaging tests. Gastric X-ray, CT and/or MRI, PET cord, bone scan. Stomach cancer is one of the most dangerous diseases of the digestive tract, with a high mortality rate, second only to lung cancer and liver cancer. Every year, Vietnam has 17.527 new cases of stomach cancer, of which men account for more with 11.161 cases and women 6.366. According to Globocan statistics in 2018, that if detected late when stomach cancer cells have metastasized to other organs in the body, the patient's chance of survival is very low. On the contrary, if detected early from the onset stage, the chance of curing the disease is up to 90%. Therefore, going to a medical facility to be examined by a doctor, ask about medical history and assess risk factors can help proactively screen for stomach cancer. Early detection and treatment from the early stages helps increase treatment effectiveness and help improve the patient's life expectancy. Treatment of stomach cancer. After determining the disease and stage, the doctor can prescribe the following stomach pain treatment methods for the patient. Surgery. The doctor may remove part or all of the damaged stomach and surrounding lymph nodes. Depending on the stage of the disease, the patient may be prescribed surgery by the doctor using open surgery, laparoscopic surgery or robotic surgery. The doctor may remove part or all of the damaged stomach and surrounding lymph nodes, depending on the stage of the disease. Radiotherapy. Radiotherapy can be used as an adjunct after surgery to reduce the risk of local recurrence. Radiotherapy may also be indicated in some cases of metastasis to bones, lymph nodes, etc. to relieve symptoms. Chemotherapy, chemical treatment. Chemotherapy is the use of drugs given intravenously and/or orally to treat cancer. Chemotherapy may be given before and/or after surgery. It may be combined with radiation therapy. Chemotherapy regimen depends on the stage of cancer and the physical condition of each patient. Targeted therapy. Targeted therapy is often applied to locally advanced disease, recurrent disease or distant metastasis, when surgery or radiotherapy alone cannot completely destroy cancer cells. At this time, the patient will be prescribed targeted therapy drugs, can be combined with chemotherapy, to limit the growth and invasion of malignant tumors. Palliative care and treatment. When a patient is diagnosed with incurable stomach cancer, the doctor may prescribe palliative care and treatment. This is a medical care method combined with nursing to reduce the patient's physical and psychological pain symptoms. Prevention of stomach cancer. Stomach cancer is increasingly common in younger. Treatment is expensive and difficult, especially if detected late when cancer cells have metastasized. There is no cure. Therefore, people should improve the prevention of stomach cancer early by maintain a scientific lifestyle, exercise and rest regimen. Maintain a healthy diet with foods rich in vitamins and fiber. Limit foods rich in nitric and secondary amines such as pickles, pickled eggplants, fermented foods, smoked meats, and grilled foods, because when entering the stomach, These substances will combine to form toxins that cause cancer risk. Do not smoke, drink alcohol or use stimulants. Limit processed foods and bottled soft drinks. Actively screen for early stomach cancer in cases with risk factors. Although the common age of stomach cancer is 50 years old and above, in recent years, this disease has tended to be younger and more common in people under 40 years old. However, if detected early from the onset stage, the chance of successful treatment is high. The 5-year survival rate is up to 90%. Therefore, people should improve prevention and early screening for stomach cancer to avoid unfortunate risks caused by this dangerous disease.